Welcome back. We continue our coverage on the topic of paid leave with some dynamic voices on the subject. Joining me now are Lee Fitzpatrick Sneed, a fellow at the Catholic Association from Granger, Indiana, Veronique Derugi, an adjunct scholar at the Cato Institute here in Washington, D.C., and EWTN's executive editor and D.C. bureau chief, Dr. Matthew Bunson, joins us here in Washington, D.C. Thank you all for taking part in this discussion. Veronique, last year you noted that leave proposals would have Americans paying $10 for a $4 cup of coffee. What is the economic impact of some of the paid leave proposals or the current paid leave proposal now?
So, we tend to often focus on the increase in the payroll tax that employees will see. But I think one of the, and it's a very valid point indeed. Very often the proposals are unrealistic about the actual cost to employees because they tend to underestimate the amount of leave that is going to be paid. But that's one important aspect, but it's not the only aspect that paid leave at the federal level would trigger. And in my opinion, these other aspects are much more problematic because they're actually not visible. And some of them is that actually in countries that have adopted generous paid leave proposals, we see like the beneficiaries actually suffering from fewer hours of employment, lower growth in wages over time, and all sorts of things. And these things are not as visible, and yet they matter tremendously.
Lee, the U.S. is an outlier among developed nations not providing leave for new parents, paid leave for new parents. But at least 17 or so states have passed some form of leave. How is leave different and critical for adoptive parents like you?
That's an important question, Monsi, and it's mostly the unpredictability of adoption and foster care. As everyone knows, that children and babies in any kind of family don't so much respect parents' work schedules. They come when they come. But with foster care, there are often emergency placements that could happen in the middle of the night. With adoption, you could have to travel several states away, and then you might have to stay in those states if the child had some maybe in utero exposure to drugs, or if there was some other problem. For instance, my son was born with a heart defect and had to have emergency surgery while we were in Pennsylvania living in a different state. So all these things come up, and it's the unpredictability. It would be very unsettling, especially with people if they don't know that they're going to have reliable income.
Matthew, why, with lower birth rates and corona baby bust, is this a necessary pro-family and pro-life conversation?
Well, as Veronique has stressed, any sort of a proposal that's being put forward has to be examined very carefully, whether it's a prudent one, whether it's effective, and whether it's actually going to strengthen families. There are a number of pro-life arguments that have been raised in favor of family leave and this type of a program. We can look, for example, at the way it potentially incentivizes having children, potentially builds a workplace that encourages family life, a culture of life. We can add, too, that it also can stress or help develop care for generational members of the family. So in other words, it can strengthen family life generationally, which is something, of course, that Pope Francis has stressed. But again, we have to be focused on the prudence of these proposals and whether or not they're actually going to help families through the creation of more children and strengthening a family life, or whether they're going to create economic problems for them in the long term.
On Pope Francis, he recently tweeted about the primacy of the family and his call to the familial experience in Amoris Laetitia. How is this debate significant for Catholics?
Well, it's very significant for Catholics because, as Pope Francis is stressing, and has throughout his pontificate, that looking at the generations, that a family has to be generational. We have to learn from each generation, and each generation has something to contribute to the other. The Catholic side of this is also bringing into stark focus the importance of family life, the culture of life, as well as, again, making those prudent decisions in public policy. Are policies actually going to improve the dignity of the worker? Are they going to promote the common good?
Veronique, back to your earlier comment, more than 2 million U.S. women have left the workforce during the COVID-19 pandemic, in part because of a lack of childcare and demands of homeschooling. Would paid leave initiatives hurt or help women advance and integrate into the workforce?
So I think we're having this conversation in a vacuum because we are having a lot of misconception. At first, I want to say I'm a big supporter of paid leave. The value of paid leave for parents, for adoptive parents, for children, I mean, it's unquestionable. The question at stake here is whether it is the role of the federal government or if the federal government provided such a benefit is actually a good idea. And first, I'll say it's not, because there are actually a massive amount of costs that people don't see but will be shouldering. And the other one is also because we assume that we actually don't have a lot of paid leave already provided in the US. The BLS provide a number, which is 17%, but this number is actually not really accurate of what we actually have, because the way the BLS asks the question, it asks specifically workers if they benefit from a program that it's totally independent from their other leaves, from disability insurance, from all sorts of other arrangement that they may have with their employers. And actually, in the US, we have already a very extensive and flexible private provision of paid leave, which is quite remarkable and unique, I should say, for industrialized nation. And unfortunately, it is true that some lower income Americans don't have paid leave for the most part, usually because they are hourly workers and temporary work. But what we know from the data is that actually government programs doesn't improve their situation. Also, we know that government programs do not actually increase fertility, which, I mean, if it is one of the reasons to actually put such a program in place, is actually it's not going to work.
What would be a good solution for these lower income, for non-federal programs? What would you suggest?
So it is really hard actually to get to those workers. And we've seen them with a lot of programs like Norway, extremely generous, 100% benefits, but even California, if you want to look at home. But these are less generous programs. This is why I think it's kind of important to look at also what the Europeans have done, where they cover the entire salary, is that these programs, even when they're very generous, they're providing a lot for the people who precisely already have paid leave right now. And so basically what it does is that it shifts the burden from the private sector to the government. But it's very hard to tap to those workers. Like, things that we could be doing is creating the more ways for people to save in a tax-free environment for whatever they want. So have like a way for these workers to actually first turn overtime into future paid leave, which right now they can't do they just simply can't do.
Right.
Or have, savings accounts that are very flexible, that are not just, for allocation towards your retirement or education, or it's just for whatever it is you need. But
right.
It is hard. It's hard.
It is hard. Lee, for at-risk families, it's hard as well, with more than 350,000 foster children in the U.S. and counting with the COVID-19 pandemic, which has raised this number of at-risk children to a number of child welfare authorities who fear that they will never be able to account for the surging rates of unreported abuse and neglect. How does paid leave factor into this decision to foster and adopt?
I think, again, with the unpredictability, to know that you would be able to, at the drop of a hat, while maintaining even a partial salary, would make you more likely to open your home to a foster child. There's different things to consider. You have to integrate a new child into, maybe you have existing children. Also, best practices would dictate that because a lot of children who have been through the foster care system have experienced some kind of trauma, they really need the security of being with their primary caregiver. And the sort of general rule of thumb is 1 month for every year they weren't living in your home. And I think paid family leave could go a lot way. I mean, of course, that's not always going to work for every family, but ideally it would.
Lee, last question for you. Do you have a message for families who haven't fostered or adopted?
I think that everyone can participate in it, whether it's making sure that, the people who are fostering children also, get the new mommy meals, and that adoptive moms get baby showers, and that just like anything, we use polite language and realize that, adopted children are your children, not, there's not different, they're not your real children, or, that kind of language, I think, stigmatizes it. And also it stigmatizes it on the behalf of women looking to maybe place their babies for adoption.
Thank you so much, Lee, Veronique, and Dr. Bunson for this very important discussion.